Assalamualaikum viewers and welcome back to our channel. Today in the playlist of oral and maxillofacial surgery, our topic for today's lecture is infratemporal space infection. So as we have discussed the other facial spaces infection as well in the following headings involving the boundaries, content, source of infection and clinical features. As far the management is concerned, for management of odontogenic infections, we will make a separate video that will underlie the guidelines and principles guiding the management of odontogenic infection. So for management of any facial spaces infection arising from those odontogenic infection, you can refer on to that video. So moving on towards our topic, that was the infratemporal space infection. First of all, we will study the boundaries. As you can see in the diagram as well, superiorly we have the sphenoid bone, the base of the skull. Inferiorly we have the lateral pterygoid muscle. Medially we have the lateral pterygoid plate. Laterally we have the temporalis tendon and the coronoid. Anteriorly we will have maxilla and zygoma, and posteriorly it is bounded by the parotid gland. So these were the boundaries of the infratemporal space. Now content involves the maxillary artery and mandibular nerve and its branches, and most importantly the pterygoid venous plexus. So source of infection, basically what was the source of infection for this infratemporal space infection? So it could be the buccal roots of the maxillary second and third molars, infected injection during the posterior superior alveolar nerve block, or spread from the other spaces, which could be the pterygomandibular space, that could be the buccal space or temporal space. So basically any infection rising in these three spaces could also spread to the infratemporal space as well. The most important point to be noted here is that infection of the infratemporal space, it can pass on posteriorly, as we have studied that pterygoid venous plexus was present out there. So the infection could pass on to the pterygoid venous plexus and the pterygoid venous plexus. Remember that we have discussed in the video of the cavernous sinus thrombosis, the pterygoid venous plexus was directly connected to the cavernous sinus through 3 or 4 imagery veins that were valveless. So infection could spread from the pterygoid venous plexus through the imagery vein, and it could involve the cavernous sinus, eventually leading towards the cavernous sinus thrombosis, and that could be manifested as the eye signs. It could be manifested as a toxic appearance, and it could be manifested as meningitis, coma, or even death. So for the infection from the infratemporal space, it has the equal chances of involving the cavernous sinus through the posterior route. Now clinical features, we can have a swelling in the sigmoid notch region or subzygomatic region in front of the temporomandibular joint, or in front of the ear extraorally we can see a swelling there. We could have the trismus, we can have the swelling intraorally as well, and that would be basically present in the tuberosity region. So this was all about the infratemporal space infection. I hope this video will be helpful for you all. Don't forget to subscribe to our channel for more videos and updates. Thank you.